go.
Okay, now we're ready.
Okay, so it's May 11th at 1 o'clock in the afternoon, and we're going to call a special meeting of the Board of County Commissioners to order and turn the meeting over to Vicki Dahl.
Well, good morning, folks, or afternoon. It's afternoon. It's hard to remember what day it is, let alone what time of day it is anymore. So when I sent this email out to Jerry, he said, yeah, let's go ahead. And then I found out that John had actually been working on items now for the past couple of weeks. So really what this meeting about is really not to get down into the weeds, but just to make sure that we can bring ourselves together and agree to have a plan. And it says our internet connection is unstable. So much, yeah, for that. So again, I'm going to do the etiquette. Please make sure that you're on mute. We still have folks who have not yet muted themselves. If you don't mute yourself, we will. So Kathleen, Larry, whoever called in on 8190, you haven't muted your phone yet. So we really don't want to hear the dogs bark, the kids cry, or the toilets flush. So please mute yourself. If you do want to say something, down towards the bottom of your screen, if you'll pull down for me. There should be either a reactions button or a more button on your screen, and that should do a little hand raise, and we'll call on you and unmute you if necessary. And so just a warning, it's only an hour, so probably not everybody's going to get a chance to talk. But this is unusual times, and we, like any other business, need to make our plan on how we're going to reopen. And so with that, I'm going to kick the ball over to John, and John is actually leading the charge in this.
Well, thank you, Vicki, and good afternoon, everybody. First off, I think we all agree that what I've heard, and I want to have this as a discussion session on, how we do bring not only our staff back, but also all of our clients. And with what uniformity are we going to be doing that across the county, and with what documents? So one of the first things we've kicked off is a Microsoft Teams site. And many of you should have received an invite to this Microsoft Teams. I think a lot of you have probably been able to utilize this. I have. I know it's a really nice site. There's some good training videos, and thank you, IT, for sending out some information on how to use Microsoft Teams. But as we continue down this road, let's utilize that Microsoft Teams site as a place where we place documents, etc., as opposed to a lot of emails going back and forth between us. Let's try to use it as our central site. Next up, Steve Bartell, Big Blue. Thank you for helping pull together the initial draft. And I think hopefully, most of you have been able to get this 4-page document, which I think we've got on here. And Steve, maybe I can ask of you to kind of unmute yourself and kind of take us through this very first draft of our reopening plan.
Sure, John. So I drafted the planning document. It's I thought it was great that Vicki sent out the email and requesting this meeting in which we could start talking about these type of things, because I had been working on this for a couple of days and with assistance of Tim Hansen and Gil from facilities. Really just as some guidelines and a thought process for departments to consider when they put together their plan. I've been involved with the EOC and the safety team, and kind of what we have seen is when the construction industry started to reopen. The governor had some pretty specific guidelines and 30 different points that had to be met or required for certain construction to reopen. We saw the same thing, and I applaud Doug Chase for all his efforts in his reopening plan of some of the parks and the golf courses. And again, it laid out very specific requirements and guidelines to be able to do that. And so I can't imagine as we continue down this road of that the governor isn't going to provide more guidance, or the state Supreme Court for the courts. And I thought we should be better prepared and have some draft plans for ramping up our operations and services, and just thought it would be a handy tool to address that quite honestly, I think all of us are going to have to address in some way, form or fashion. Also understanding that, the different departments are so unique in the services and operations they provide, that they have to provide those operations, and the challenges that we're going to face with the social distancing, and whether we start to reopen with a percentage of what we used to do, or full-fledged. Vicki made about, we have to keep our employees safe, but we also have to keep the public safe, and how are we going to do that? What I tried to do is just divide it up into different sections. The first being just the limiting the illness itself. Obviously, this has been in the headlines and in our lives daily for the past 2.5 months. So there's pretty much just some can we continue to do the things that we're doing now with staggering shifts and working from home and remotely, and do we need to add self-screening, or should it be conducted by a third party? These are all great questions that we need to answer, because quite honestly, is the equipment going to be available? I know I haven't been able to buy a thermometer in 2.5 months. So Gil is the magic man with his buying the hand sanitizer and some of those sneeze screens. And maybe he has an end, but I certainly haven't been able to crack into that market.
You don't want to know. And don't ask Gil.
Pardon?
And you don't want to know how Gil does this.
You're probably right. I just say thank you, Gil.
Exactly.
But then there's just different paragraphs and sections that kind of address the social distancing, the hygiene practices, the cleaning practices, the employee accountability. We have some elevators, so what are we going to do to address that? Our conference rooms, again, these are I think business is changed forever, in that a lot of us will be using Microsoft Teams and Zoom meetings much more effectively moving forward. How do we deal with our lunch breaks and lunches and things? And then of course, even though public meetings are not yet approved, when they are, how are we going to deal with that? So, and then the second section really was just on specific department plans and recognizing, because everyone is so different and has their own challenges, that we all should start working on those plans that kind of affect our area and our employees and the public we serve.
So with that, Steve, thank you for pulling this together on the team's behalf. This is a draft document right now for us to consider. So maybe, Vicki, maybe we'd open this up for questions, comments?
Sure, there was one more item that I think we probably want to add to that list.
Please.
And it's gonna depend in part on what the governor does. But I think one more item we're gonna have to add is contact tracing. So if we do end up, if this state does end up doing contact tracing, what kind of records are we going to have? Are we gonna have attendance records? Are we gonna have lists of customers? How are we gonna manage capturing information that would be useful? I think that's just one more thing to add to this list. So now if we could go down and just grab the participants and bring the participants list up and see. So if you do want to say something, you can either raise your hand or unmute, and we'll try to do this. Tim Fitzgerald has his hand up. Woohoo! Okay.
Just a quick comment, as we're talking about this as a large group, I would also recommend as part of our approach that we also break down in specific areas like the law and justice community, the external services community, just different areas, because there's different focuses that we're going to have to do that pertain specifically with our groups. So I sit in the law and justice group. There's a lot of things that we're going to do that are really specific and isolated to the courthouse. It will impact the treasurer, auditor, and assessor and the commissioners, but it's, with the courtrooms and how we're going to handle people coming to the clerk's office and the prosecutors and public defenders coming in. So I would just recommend small groups also as we start putting our bigger plan together.
Agreed, Tim. And I know the law and justice team is meeting this Thursday at noon to have that specific conversation. Other comments?
No hands going up.
Well, let me just pose a question to the team then. As we come up with these different plans, how uniform across our entire county do these plans have to be? Do we have a plan for the courthouse as opposed to public works? Or should we strive to make them somewhat similar? When we talk about things that we might impose on our clients coming in, do we also have to model that then with our staff? Thoughts on the uniformity of our plans across the county or not? Anyone?
Can I speak to that, John? Steve here again.
That
Well, I think, I think there are the primary issues that have to be uniform across the board.
Mhm.
And I think that we can establish those fairly easily with just the CDC requirements and the governor's requirements for, social distancing and so on and so forth. And I think it's going to involve, and like I had pointed out in this planning draft, that my loss control specialists, the three of them, they have assignments to liaison with every division and department. And for the EOC, they've been highly involved with doing those site assessments to assist those different, well, and quite honestly, a lot of them are volunteer organizations, come up with a safety plan to make sure that they can comply with all of those issues that we've been discussing here. I do think, though, there are going to be unique situations, and those will come from those hazard assessments. For instance, pinch points in your facilities. There are just some areas in which it's almost impossible all of the time to maintain that social distancing. So, what are the options there, and what are the special requirements for those type of areas? And they're, all three of them are very much on board. All you need to do is reach out to them, and they will help you assess those areas for those core things that are currently required in all areas throughout the state.
So one of the other things I think that would be helpful, and I am so not trying to put Gary on the spot, so you're not on the spot, is an understanding of what kinds of expenditures are suitable and allowable under any of the funding that we've received, if any, from the state and the feds. So a lot of us are dealing with the sneeze barriers at our front counters. So thankfully Gil found some of us have much wider areas that have to be filled. So we found a couple of places to order from. So that would also be very helpful to know what we're going to have to just try and do in our own current budget versus what kind of monies are out there and available that we could tap into.
So if an expenditure was included in your budget for 2020, it's not reimbursable. But any expenditures that you had to incur as a result of the virus are eligible for reimbursement. And it's reimbursement of expense. It's not pre-funding the expense and stuff. So when you go through the guidance, that is one of the criteria for determining what can be. So if you, for instance, your time to deal with the virus would not be reimbursable because you're salaried. So regardless of what you spent your time on, you're still, but if we had to hire an outside consultant to come in and address the COVID, then that could be reimbursed. So that's general parameters, but we can give you the specific language that came with the guidance. And John has that. It's what, about
It's 4 pages. I'll post
pages of guidance that we can give you.
Right, and I'll post that on our Microsoft Teams site just to practice what we're preaching. And to add to what Commissioner French is saying, the dates are March 1st through December 30th, when we can incur these expenses that had not been budgeted before. So like, for example, when Gil was able to find those sneeze shields, unbudgeted, we purchased it after March 1st. It's right in line with the reimbursement from this CARES Act money that we have received directly from the feds. But to Vicki's point, some of us might find that we're going to have to invest in some things to make our areas even safer for when we introduce our clients. I think your point is, let's keep track of those types of costs. And Gary,
and that actually is, there actually is a coding process in PeopleSoft to track all of the COVID-19 expenses. So please work with your accounting techs who are aware of it, your accounting professionals in your own offices, and then those in financial services. So we do have a process in which we can track all of that. But yeah, we're still going to need to collaborate on what those items are that we can buy, what the money can be used for, and of course, how much money we're going through. Because do I want to spend $35,000 on a piece of software that makes it possible for us to receive marriage applications remotely?
Mhm.
Is that really a good investment or not?
Right.
Yeah. So I can hear Tony Hall just cringing at the thought of everybody just running out and buying things. So I'm rooting for you, Tony.
So be thinking about that. And hey, Steve Bartell, another question. Let's talk about these department plans and how informal or formal that we might want to have those. Steve, what are your thoughts on, which is page 4 of what you helped pull together?
Yeah, John, I strongly feel that each department or division or work area should have a written plan. And, one of the things that's required or has been required is that the staff are all trained on that plan. So they know exactly where it is and it's posted and they understand what's in the plan. On another subject I just thought about when we were talking about, this unified restrictions or items or purchasing. Doug Chase out in Parks has done a magnificent job of signage And I mean, very professional, very visual, very nice looking signage. And I believe that the expense was fairly reasonable as well. And I think we can all utilize some of those same already designed signs. We just need to order a bunch. When it comes to social distancing and you know, all those the cough and sneeze etiquette and so on and so forth. So when I was reviewing, you know, his stuff when he was getting ready to open the golf course, I was very impressed with that. And I think we need to reach out with them. I believe he uses a third party company that made those signs up, and they were I can't remember the material that they're made on, but they're very durable and they can be wiped off, but you know, they're not paper, you know, that just kind of look trashy and so on and so forth. So that would be a great, I think for everybody, you know, we could come up with a multitude of the same signs that we could all hang in our public areas and our employee bulletin board.
And Steve, back to you. Steve, with these department plans,
Yeah.
is there an outline that you'd recommend that department heads and electeds utilize?
Well, you know, so the planning document that I wrote up, I know it's 4 pages, but it had a lot of fluff in it with questions and examples and different type of things. But I think if they follow that format, they address each one of those areas that we're going to have to address sooner or later. And obviously, if there's a section in there that doesn't apply, if you're in a building without an elevator, you certainly don't need to do anything about elevators in your area. But I think if it follows that format and you can answer the questions or put in place what you need to do specifically for your operations and services and facility, I think that would.
Thank you, Steve. And Tony, we also are using the group chat right now. You've got an idea, Tony Hall.
Yeah, so we have in that Teams site that you made, John, we have the ability to share spreadsheets. And I think, Gil, you and I can probably get a good start on what we've bought already and where we bought it from. And then everybody else can have the chance to go in and edit and add. So if Doug has a special vendor, he could add that as well. So Gil, I'll take that offline with you. We'll work on a list, and then I'll send out a link to everybody in this team and let them know how to get to it.
Hey, Tony. Hey, this is
Yes,
Gil.
sir.
Hey, I forward Jason an updated one of everything that we purchase and who we purchase it from. I believe he is collecting that data. So.
Perfect. I'll get that from Jason then.
Okay. Well, I have it if you need it.
My Jason?
Okay.
Yeah.
He's probably not back yet.
Well,
He's working though. Yeah.
But the idea here is let's utilize Microsoft Teams, Tony, as I hear. We'll put this spreadsheet right in Microsoft Teams as y'all get more and more comfortable with it. And we can try to keep that one document. We'll keep adding to it for our proposed COVID-19 expense. Thank you, Tony.
Yeah, no problem. I'll include some instructions on how you get to that file and how to edit it as well. So I'll do that today.
And I think we should also strongly consider using this Microsoft Teams site. Steve, back to your idea on that, our departments do each come up with an appropriate level of plans. Let's put all of our plans also on this Microsoft Teams site. And if we can steal shamelessly from each other some really good ideas, I think that's a great idea. Steve, one more question to you. You offered up a very valuable resource that you've got, your loss control specialist. Thank you, by the way, for so quickly going up to the 8th Avenue building. What's the best way if any of our leaders here want to get a hold or utilize any of your 3 specialists? What's the best way to go about doing that?
So on the risk management page on County Ideas, there's actually a list of the LCS is what we call them, assignments for the departments. So if you're not quite sure who that loss control specialist is that's assigned a liaison with your department, that'll provide the list. All three of them are on a kind of a split schedule, working from home and working at the office. All of them have their office desk phone forwarded to their cell phones and their emails. So all of them are able to remote into their desktop. So phone or email would work just great for them.
So just to reiterate, Steve, what I think I hear, hey, just give them a call and
Yes.
have them come visit any of your departments where you'd like a loss control specialist with their special skill set to take a look at some ideas that you might want to put into your department's plans for the reintroduction. Did I get that right, Steve?
Yes, and what we did for the, we came up with a risk assessment document, very simple, 1 page. Has some color in it. It's not a real wordy document. It points out kind of the issues and the recommendations for control and what is. We also posted all those site risk assessments on Teams with the EOC. And I think that's a good idea to do that too. It's not a, hey, this site's better than that site, or this has more problems, but it certainly will provide everyone a chance to review some of those and see kind of the things that are similar and the things that are different from different facility to different facility, or different service to different service.
Hey, Steve, this is Mike. Hey, so do we have a sense of, obviously, we're not going to go back to 100% all at once. Do they have an idea of restrictions are going to be loosened? Do we do it, or is that up to the department to try to figure out how we would like to reintroduce our services? Can you speak to that part of it, or John?
Well, Mike, I don't know for sure is the answer. My opinion is, looking at how the governor is starting to reopen businesses. When I look at restaurants and different facilities that have a bigger capacity of people, he seemed to like to use the 25%, 50%, 75%, and then full 100% theory. Just kind of a stair-stepped approach. I don't know if that'll be like that for government or other businesses, but I would guess, if I was a betting man, I would bet that he's probably going to come back and request that every step back into the reopening process. So I would recommend thinking about can I bring back folks, 50% of the folks first, and see how that goes, and see if there's new challenges that develop. I just think that's good risk management anyway, instead of just dealing with the full, oh, let's swing the door open and everybody come inside. I think it makes sense to think about a 50% reopening, or expansion of services, and then when everything is going well and we've worked out the bugs there, then we can ramp it up farther.
Hey, Tim Hansen, I see you there. Any additional comments, just from an HR perspective on what Steve Bartel just brought up?
Well, his comments are all great. The one thing I think all of us are going to be confronted with are employees that are saying, gosh, it's worked really well for me to work from home. I want to keep working from home. So I guess the suggestion to all of us is know in advance who you think could or should be working from home and why, so that you can explain to the person that you don't think should be working from home, why that is. I think that's going to come up a fair amount.
Tim, a few of us might also encounter folks who might be too nervous. They don't want to come back to work, but yet as leaders of the county, we say, well, we do need you back at work. Any recommendations there?
Yeah, that clearly could happen. We've set it up so that if that's the case, and you're in agreement with it, they can leave. Aware of any other federal program that says, you get to stay home just because you're afraid of coming to work. Certainly you want to be sensitive to their concerns. They still, the other thing you might consider doing, there are a number of us that are high risk, and they may say, I don't want to come to work because I'm high risk. Now that may be an Americans with Disabilities Act issue, and you may have to interact with them from an ADA standpoint. Sarah and Heather in our office can help everybody with that process.
Any other comments? Anybody, any questions, concerns?
I have one, John, just to add to what Tim was saying. We've relaxed, in the telecommuting policy as it was initially and adopted, we made it pretty clear that this is not when you have kids at home, it's not an alternative care. But as we also know, with the schools shut down and will be shut down for the rest of the year, that's still going to be an issue. So, departments are going to have to consider those folks that have school-age kids, that they don't have any daycare alternatives. I got to think that those daycares, again, if you kind of notice when they open up, they're down the road a bit too, and also on kind of a stair-stepped, 25% capacity, 50% capacity, if I remember correctly. So, that is going to be something that we need to consider to help our employees there, time especially.
Tony, did I see your hand? Tony DeNaro?
Yeah, I just wanted to weigh in on employees who are maybe high risk or have medical conditions. If you are gathering that type of information, it's probably best to have them submit it to HR, or rather than send an email that states all of their medical conditions. That can be very tricky from a public record standpoint in terms of what you can redact and what you can't redact. Under HIPAA, if they're not sharing it with you as a licensed medical provider, then it's hard to redact. So if someone wants to provide documentation about a medical condition or an ADA claim, it's probably best to have them work through HR to do that, rather than just ad hoc sending emails back and forth.
Anybody else? Comments, questions so far?
So one question I do have is, Commissioner French, what's your best guess as to timing? Realistically, when you think under the governor's 4-step plan, we might realistically open the door for the first time? Just so we know how much terror we have to have in trying to get this done and how quickly.
So just to bring you up to speed, this afternoon, we expect the health board to accept a letter from Dr. Lutz authorizing us to move into phase 2 of the reopening plan. I would expect that the Board of County Commissioners will consider accepting the recommendation from the health board either later on tonight or tomorrow afternoon at its 2 o'clock meeting. And then we'll send the request off to the governor, and then it's in his hands as to whether he accelerates Spokane County into phase 2, or he keeps us on the same timetable that he's got the other 3 large counties on. So it's difficult to predict what the governor will do. In a best case scenario, maybe the end of this month, first part of next. In a worst case scenario, the end of June, first part of July. It's hard to say what direction he's going to go in.
So it really behooves us to move this along. And that's the team side. We can also put the Safe Start document from the governor's office that lists all 4 stages.
Already put it there.
You're
Started
so
there.
good. He's so good. He
What's
just.
that?
Instant.
Ashley, do you have a question? Comment? Ashley Callan.
Your mic's off, Ashley.
All right,
There you
can
are.
you hear me now?
We can hear you now.
Fantastic. I'm curious what the timeline is, or how are we going to approach whether or not employees need to be screened before they come into places, if citizens should be screened, and the whole mask thing. I mean, those are three big questions that I don't think each department can draft what we're going to do, because what each one of us is going to do will impact the rest of the departments.
So Ashley, I think that was addressed a little bit earlier. Tim Fitzgerald had a great suggestion. There are subcommittees or teams that are developed that deal with, whether it's law and justice, or whether it's external services, or whether it's internal services, because I think you're spot on in that, the clerks and the courts and those folks that are all working together are going to have the same or very, very similar criteria. I like the idea of the masks. And again, it's been said several times, the masks don't prevent the employer or us from anything. What it does is it prevents everybody else from from contracting something. And, there's also requirements, even for those cloth masks. I mean, once you wear them for a day, they need to be washed, right? As soon as you touch them on the outside, they need to be. And then, there are some folks that can't wear N95s because of lung conditions or whatever. So, we've got to be mindful to that. I mean, we don't need to be like, what was it? They had at Walmart where a couple people got shot because they got in an argument over freaking masks. But my opinion has always been, if we can determine where the pinch points are in which we cannot maintain the 6-foot social distancing, that's the areas that I believe we need to make sure that we require that masks are worn when folks are in that area. But agree, I think there's a lot more discussion to be had between the different groups. And, I think, again, different facilities, different operations are going to have more unique services.
And I guess my hope, as we all develop plans, we'll share them, because like Tim said, what the courts choose to do, or what we plan to do, impacts everybody on the first floor of the courthouse. And so that's where trying to divide it up into our different teams is a little tough, because we're not grouped that way on site, I guess.
These words are actually really a good selling point.
So do you want me to ask the question for Ozzy?
Yes.
Yeah.
So Ozzy, as I read the letter from Dr. Lutz, he is recommending that we move into phase 2 now. And so he hasn't set a date that says so many weeks from today. He's saying that we in fact, it says consideration be given, provide Spokane County a variance to move to phase 2 to the governor's Safe Start Washington plan. And so that's immediately. There is no date.
Good. I'm glad to hear that.
Yep.
And again, any opening would be dependent on our ability to meet those requirements that are set out in stage 2.
Right.
Jeff, or Judge Smith, what do you think? What are the courts thinking as far as, starting to loosen up and have some more cases? What I'm afraid of is a sudden tsunami hitting the jail, and then knock on wood, we haven't had any cases, and many of the jails in the state of Washington can't make that same boast. There's a lot of them and have a lot of cases inside their jails. So I'm very conscious that we're going to let this flow back in, still maintain the requirements that Steve Bartell, social distancing and having an opportunity to do those things. And so those are kind of the things I'm a little nervous about, and how that's going to have one case. And, we're talking 500, 600 people it could spread through. So have you got a sense of that, Jeff?
Yeah. So what we're planning on doing, I mean, we've already done this, Mike, 'cause we've set up, and we've actually gone in the courtrooms and measured out 6-foot barriers, in each one of our courtrooms to find out how many people we can actually have in a courtroom. And John, you can weigh, John Witter, you can weigh in here if you like as well. But I mean, I think our largest courtroom, max amount of people in there is about 50. As you know, in district court, we have a very high volume court. We have a lot of people coming through these doors. And we're trying to figure out how to structure our dockets so that we can handle, smaller groups of people. One of the things that we're planning on doing is also, moving to a virtual courtroom where we can conduct some hearings virtually to prevent folks from having to actually come down to the courthouse. We're in the midst of that. We should be having our first actual virtual court hearings probably by the end of this week, first part of next week. We're starting with a private defense bar first to kind of get the kinks worked out. I've talked with Tom what it might look like from a public defender's perspective. We've got, I think, some hurdles to get over there and some things to work out there. But we're going to start with the private bar, see what we can do, start with some civil cases, and just kind of, ease our way into these virtual hearings. But we're hoping that that's going to, decrease the amount of folks that are coming down to the courthouse as well. So, those are some of the things that we're contemplating and working on. I've had a chance to meet with Judge Clark and Judge Antush, and we're trying to, coordinate and make sure we're all on the same page as far as what we're thinking about, as far as, getting people in and out of the courthouses. Juries are probably the biggest concern and biggest issue right now. How you convene a jury pool is going to be very tough with the social distancing issues, whether that's done off-site at a place like the arena or somewhere. We've got to sort those things out. The jury trials on the criminal side have been pushed out till first part of July. Civil trials, they're out into September, October at this stage. So the jury issues are going to be probably our biggest and most complex thing to deal with. How do you sequester a jury away to deliberate while maintaining all of the social distancing and other safety factors in place is going to be a real challenge. So I don't know if that answered your question, Mike. I will say that we have been thinking about this for quite a while. I've had a chance to talk with Steve Bartell a fair amount as well. And we've got a plan in place. And the primary plan is to limit the amount of people having to come down to the courthouse.
Okay, thank you. I appreciate that. I just got to have kind of a sense of how quickly this is going to come at us, and kind of do some interior planning or some internal planning to make sure that we're ready for it. So.
And hey, Tony DeNaro, thanks for your most recent posting. Why don't you just kind of reiterate your points about our expectations from the public?
I just think a lot of the frustration that members of the public, not here at the county, but at grocery stores and elsewhere, has been that there's not uniform guidelines, or it seems like there has been confusion around them. I think that as much as we can, if we make the safety protocols for the public uniform, that could avoid some of that. If people are going into the courthouse and have their temperature taken, but then they walk into the public works building and it's just a free for all, they're just going to say, why is it like that?
Good point. And we'll just, for those of us, and many of us do have customer service areas, that'll just be another line of discussion. I know most of us have locked those down and have found ways of doing it virtually. But Tony, to your point and others, as we do introduce the public back into our courthouse, our public works building, et cetera, we'll try to see as standard and as uniform of an approach that we can use. Could be beneficial.
And I'm hoping we get a little more direction from the governor on specifics, as well as from the Supreme Court, as far as how we're going to handle, the people coming in and out of the courthouse. Whether we're screening every single person that comes through with, some sort of temperature taking device. I don't know what that looks like, or, ask them certain questions as they come in. Do you have a cough? You've been exposed? You're feeling fatigued? All those kinds of things. I think I'm hoping the governor's office and the Chief Justice are going to give us a little more direction on as it relates to that, because I agree, Tony, 100% that whatever we're doing over here in the public safety building needs to happen in the main courthouse, needs to happen in municipal court. Otherwise, it will be some chaos. Trying to figure out how you're going to take everybody's temperature coming in the courthouse, and we've got a line out the door with, 60 folks on our 9 o'clock docket, how we effectively are able to get those people handled and through security and through the screening process up to the courtroom, logistical challenge. And so, yeah, again, I hope that the governor and the Chief Justice give us a little more direction down the road as far as what the expectations are. I will say that we do have employees, we do have attorneys that are concerned about it, and they may be high risk themselves. And they're concerned, okay, what does this look like if I've got to meet with a client and nobody's screened them coming into the courthouse? So there's some legitimate questions and issues that we really need to address.
Commissioner Kearns.
One of the things I wanted to highlight, for over the past month, we've been telling the public as much as possible, if there are things that you can online or over the phone to do that. Just because, when the time comes, just because we can open up the courthouse and go back to normal, I don't think that necessarily means we should normal the way we've always done things. I have spoken with a number of the departments that are on this call, how you've been able to successfully operate your individual departments with telecommuting. That's something that I think we need to embrace, and we need to continue doing that. I know many of the departments are not going to be able to do that to the extent of other departments. There are situations where, yes, people do have to come down to the courthouse in person, but to the extent that we can continue to encourage people to utilize the website, utilize just a good old telephone to get the services they need, that it just that much more stress off of the facility, that less more people coming through the front doors of all of our buildings. And I think it's something that again, just because we can go back to the way it was doesn't mean we necessarily should. So I would like to see as many departments as possible continue to embrace the innovation, of telecommuting the way it's been at the county. And, if there's ways that you can improve that you can monitor that the workload is there and the work quality is satisfactory, I think we need to continue to do that.
Commissioner French, any closing comments?
No, we live in hope that the governor will get us into phase 2 so we can take the next step. We'll know that here in the next couple days.
So in the meantime, as we close up this discussion, look at that 4th page of what Steve Bartell sent out to all of us on department plans. Think of your department. We'll set up a page within our Microsoft Teams site where each of you can start posting your department plans. My recommendation, start simple and start posting those. Let's take a look at each other's plans every so often to see where we can, like I said before, steal shamelessly from others. It sounds like the best case scenario might be at the end of this month where we might start seeing folks. So my recommendation to you is maybe by Friday, the 22nd of May. Give yourself a couple weeks. Take that first cut at your department plan on reintroducing folks. If you want some additional professional help on that, Steve Bartell, thank you for offering up some of these loss control specialists. These folks might really be able to help you fine tune your plan. But let's make it a point to get those plans onto our Microsoft Teams site. My final question to you was, is this of value, this get together we're having right now? And should we plan one maybe in a couple weeks to see how we're doing?
I think it is,
I see a
John.
thumbs up. Thumbs up.
I think it is,
some
and I
people
think,
have found their emoticons.
All right, Steve.
Right.
yeah, I think it's of great value because again, you know, one of the things I took away was, you know, Vicky's comment about contact tracing. I have to add that to that document. There's just no about it. And I think once we have that, you know, initial time to draft up a plan that, you know, pertains to our areas, it could possibly raise a lot more questions. And, you know, again, we're better as a group than we are individually. Help each other out, and I think we can get through this great.
So today's the 11th of May. Why don't we all try to do our best to get a department plan by Friday, May 22nd, and we'll plan another get together like this. At this time, we'll go 1 to 2 on Monday, the 25th of May. And we'll just have that next discussion like we're doing right now. But many of us will have really pulled our department plans together. Maybe we can go into a deeper discussion on what that looks like. And then how, to Tony DeNaro's point, where there might be similarities, where there might be differences. And any final comments? Because I know we do have a 2 o'clock meeting coming up.
And John, I was just going to say Monday, May 25th is actually Memorial Day. So
Tuesday, May 26th.
Well, as long as it doesn't conflict with the 2 o'clock.
Consent agenda.
Okay, we'll find a time.
We'll find a time. We won't make you come in on Memorial Day. Thank you all very much.
Well, they didn't come in for this, so.
Take care.
Yeah.
What's there to do on
Yeah,
that?
that one's all cleaned up.
Boy, they're dropping like flies. Holy cow.
Yes. Hey, Ron.
So you